Behind frequent hospital fires, 24 fire incidents in hospitals since August have killed 93, mostly COVID patients. A look at how a high patient load and arrangements for the pandemic have stressed the hospital system, making it vulnerable to fire. As many as 93 people, most of them COVID-19 patients, died in 24 accidents of fire in hospital in India since last August. Why are these fires placed regularly despite the hospitals having passed fire checks and audits? Where, when, how many? 11 of the 24 fires were major fires and 13 were minor ones. More than half these fires occurred in March and April, when rising COVID 19 cases snowballed into a second wave. Of 59 deaths from hospital fires in the last 2 months, 33 deaths were reported from Maharashtra in 6 fire incidents and Gujarat in 3 fire incidents. Counting from August, 43 deaths in Maharashtra and 35 in Gujarat have been reported till date, the latest being in Bharuch, where 16 patients and 2 nurses died. Overstressed ICUs, ACs. Fire experts blame as overstressed hospital system unable to bear the rising patient load for the frequent fire incidents. Hospitals are increasing beds, equipment and staff to admit more COVID patients, but it is not possible to immediately expand the electrical wiring system. Medical equipment or wires carrying current beyond their capacity can overheat. That is what is happening in many hospitals. We don't need just a fire audit, we also need an electrical audit. In well-treated hospitals, Nagpur, where a fire occurred in the intensive care unit on April 10, fire officials found that hospital had added more ICU beds in a limited space, making it easier for the fire to spread besides putting a burden on the existing electrical system. In 13 of the 24 cases, the fire began in an ICU. These hospitals' ICUs did not function up to 100% capacity before the pandemic. The ventilator equipment, air conditioners are working 24 into 7. It puts a pressure on the entire system, said Santosh Warik, Director Maharashtra Fire Services, adding that ideally air conditions need to run for 15 to 16 hours and then need a cooling period. A backup AC is necessary, which is absent in small hospitals, he said. In a fire in Vijay Vallabh Hospital in Virar outside Mumbai, which killed 15, and in Ayush Hospital, Surat, which killed 3, the fire began from the AC in both cases. The AC had functioned for 24 hours. Unche said, instead of cassette or window AC, air handling units must be installed in ICUs to circulate air, as they are better workhorses. So, more inflammable material. In Gujarat, fire officials have noted that ICUs lack cross ventilation. This is the case with all ICUs, as they are sealed for the purpose of keeping them sterile. In addition to Due to COVID, there has been an increase of inflammable material in hospitals, sanitizer spills and vapor, higher oxygen content in the air, PPE kits which are made of synthetic material. A fire official said highly inflammable materials as these spread fire quickly and leave very little time for a response. Temporary hospitals. In makeshift hospital, jumbo centers for COVID patients present their own challenges. They are made of highly inflammable material, and sprinklers or fire alarms are difficult to install. Only fire extinguishers can be provided. Suresh Kankani, additional municipal commissioner, said that to prevent a massive mischief, they have placed a fire engine next to the Mulund, Dahisar and Bekesi Jumbo centers to reduce the response time to seconds. Dahisar Jumbo Center, 2 minor fire incidents were reported in the last 6 months. One in an overheated high-flow nasal cannula machine and one in an inverter. A doctor from the center said the capacity was for 85 ICU patients, but the rise in fire forced them to expand to 100 ICU beds. That has put pressure on the electrical lines, equipment, everything, the doctor said. Thank you.